Today we're going to talk about metabolic syndrome, what happens, what does it look like, what are the problems with it, and what can we do about it. So some of the risk factors, number one is obesity. Carrying too much fat mass is hard on our vascular system, so we got to watch out for that. We have increases in blood pressure, increases in glucose. We talked about that in the diabetes video. Oftentimes insulin resistance is one of the first symptoms or helps lead to a metabolic syndrome. And then dyslipidemia, this is looking at our triglycerides. LDL, HDL is good cholesterol, LDL is bad cholesterol. I'll explain that in a second. And eventually this can lead to atherosclerosis, which is a narrowing and hardening of the blood vessels. Let's check that out here. So what happens in our blood vessels is we can get plaque to build up. And the way that occurs is, if you can see right here, this inside layer of the blood vessel. This is called your endothelium, and it can become damaged. Sometimes high blood pressure damages it, high sugar levels can damage it, and this can lead to some issues. So once this gets damaged, it can get broken, or it can lead to some, I can make it like a little bit more sticky, like the blood doesn't just flow through. And if it gets damaged, what can happen is our cholesterol or our LDL can actually leak through, and it can start to accumulate. And this causes some problems because eventually it can lead to plaque formation. So when these LDL cholesterol units start to bleed through, we have white blood cells. They want to clean that area up, but eventually you can get a big mixture, especially if it happens too much, of like this cholesterol and white blood cell, or just cell accumulation there, and it's just a little toxic mass. As you can see, this yellow toxic mass, and that's plaque buildup. The problem with this is it begins to narrow our blood vessels, and that can further increase blood pressure because now we have less volume for our blood to flow through. And let's look at blood clots. So this is a picture of a blood clot, but this is where it gets really dangerous. So we have platelets in our blood, and these stop us from bleeding out. So let's say you get a cut somewhere on your arm, you're going to produce a scab, and that scab is the blood clotting up, right? And that's going to stop you from just bleeding forever. Well, this can happen inside of our blood vessels too. So if we get damage to that blood vessel, and you're leaking out blood, then you're going to clot that area. And then what happens is these platelets, we get some fibrin strands growing. You can see this in this clot a little bit. And then it just creates like a little mass, okay? And that's a good function to have, right? We need that so that we don't bleed out whenever we get a little cut. But if this is happening inside our cells, this can cause some problems. We do have proteins that can re-break this down, but sometimes they don't always work. And if we're clotting often, another thing that can cause these blood clots is if a little bit of this plaque actually breaks off, your body views that as an issue and something that needs to be clotted. And so you can start producing blood clots on this plaque actually. Well, if you develop a blood clot, sometimes it can be at the area itself if we break some of this plaque off, or it could have occurred somewhere else, and then when that breaks off, it starts flowing through our bloodstream if those proteins didn't break down that clot. And then, as you can see actually on this very last picture here, is if it fully blocks the blood vessel, we do not get any more blood flow. And if this happens in your heart, it's called a heart attack, which is obviously not good. It stops the blood flow, which then means there's no oxygen delivery, which means that muscle that is relying on that blood flow starts to die. It can happen in our brain as well. And if it happens in our brain, again, that brain tissue that is blocked from blood flow is going to begin to die because it doesn't have any oxygen. So that's why this is so dangerous. That's why we need to take care of our blood vessels because, we don't want heart attacks and we don't want strokes. That's what happens if it's in our brain. So some of the symptoms, let's look at, because this can occur anywhere in our body. So if you get one in your arms and your legs, this can lead to limb swelling. If it can block some of the water moving out in the blood vessels, we have changes in color. So your leg can turn like reddish or bluish, particularly around the vein that is being occluded. We can get pain. This can be dull to intense, trouble breathing, and cramping in your lower leg. So don't self-diagnose yourself. This is a disease that happens over a long period of time. But, cramps can happen from fatigue usually, but if you're not getting oxygen, that can lead to a cramp. It can happen in our heart. Obviously, this is a heart attack. We get chest in our pain, or pain in our chest, oftentimes in our left arm, sweating, trouble breathing. It can happen in our lungs. This is particularly dangerous because it's close to our heart, so that blood clot could move to our heart. If you have a blood clot, sometimes in your legs or somewhere, you need to go to the doctor because there's medications that can help break down that clot, and if that clot like gets dislodged and moves and travels to your heart or your brain, that's where we're going to have serious problems. So chest pain, cough, dizziness, you get the idea there. In our brain, it could cause, this is a stroke again, blurry vision, speech problems, so slurred words sometimes can be a symptom that somebody is having a stroke, seizure, feeling of weakness. As the blood flow is reduced in the brain, the problems start and they get significantly worse. So watch out for that. Can also happen in our intestines, so I'll let you check out those symptoms there. And then same in our kidneys, it can happen. So oftentimes blood will be produced in our urine or in our stool samples, fever, blood pressure increasing, lots of problems. You get the idea. So what can we do about this? In order to reduce our risk of atherosclerosis or metabolic disease, we can reduce our LDLs, so that bad cholesterol, saturated fat a lot of times is this. That debate is complicated. We'll get into that later in another video. Decrease our blood pressure, so stress increases this. Smoking increases this, so you can decrease your smoking. Salt intake decreases this, or increases blood pressure, so you can decrease your salt intake. Sugar intake is not good for insulin resistance, so we should be avoiding those high sugar foods. Decreasing fat mass, that's going to increase inflammation and a lot of problems there. Again, only if we need to decrease fat mass. Exercise can really help. So exercise just helps across the board with insulin resistance, maintaining overall body composition, and then increasing our fiber intake. And this is going to help us again with that insulin response. We want to have high fiber. Fiber is in grains, fruits, and vegetables. So this is why we want a plant-based diet. Okay, I think that's good for this video. I will see you in the next one. If you have comments, you can leave them below in the comment section. Thanks for watching.